So as you mentioned, recurring UTI, but what about recurring bacterial vaginosis or yeast infections? So some women do have recurrent yeast infections. That's pretty common to see that. What usually I would do for these patients in the first instance is make sure that there's no reason for them to be getting yeast infections. So go through all their hygiene. So make sure that they're not sort of using all these over-the-counter, vaginal wash products, because sometimes those can cause an issue. Make sure they're not using lubricants like KY jelly, because often those have things like antiseptics in it, which can trigger yeast infections. Make sure that they are not iron deficient or they're not diabetic, because those things can, being iron deficient or being diabetic can also trigger yeast infections. If they're doing everything as they should and they're still getting yeast infections, what we do is we send a sample of the discharge to the lab, and we try and grow the yeast to make sure it's not one that's insensitive to diflucan or the usual treatment, which is fluconazole. If it is sensitive, then what we can try is giving like weekly fluconazole or diflucan for, say, a 6-month period to see if that helps. So, we treat it as an individual case-by-case basis, but there are treatments that you can give, and bacterial vaginosis would be a similar sort of thing. You have to go through the reasons why someone might be getting recurrent bacterial vaginosis and treat them accordingly. But yes, we can start to see it more commonly at perimenopause or menopause, but younger women can also get recurrent BV or yeast infection as well.